Junior's acetaminophen is used to relieve mild to moderate pain such as headaches, menstrual periods, toothaches, and backaches. It is also used to reduce fever caused by cold or flu. The recommended daily dosage for children is based on their weight, and it is important to follow the dosage instructions provided on the package or by a healthcare professional. It is best to take this medication with a full glass of water and to avoid taking it on an empty stomach. Remember to never exceed the recommended dosage and to consult a doctor if the pain or fever persists. When taking Junior's acetaminophen, make sure to follow the dosing instructions on the product package. It's important to use a product specifically meant for children if you are giving it to a child. Use your child's weight to find the right dose on the product package, or use their age if you don't know their weight. Shake the medication well before each dose if it is a suspension, and use the provided dose-measuring spoon/dropper/syringe to ensure the correct dose is given. Do not use a household spoon. For rapidly dissolving tablets, chew or allow to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Remember not to crush or chew extended-release tablets, and for effervescent tablets, dissolve the dose in the recommended amount of water, then drink. It's best to use this medication at the first signs of pain, as waiting until the symptoms have worsened may reduce its effectiveness. Do not take this medication for fever for more than 3 days unless directed by your doctor, and for pain, do not take it for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat with other symptoms, consult the doctor promptly. If your condition lasts or gets worse, or if you develop new symptoms, make sure to tell your doctor. If you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects while taking Junior's acetaminophen, it's important to contact your doctor or pharmacist promptly. However, this medication usually has no side effects and many people using it do not experience any serious issues. While it's rare, a very serious allergic reaction to Junior's acetaminophen can occur. If you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As for the optimal timing to take Junior's acetaminophen, it's best to follow your doctor's instructions. The daily dosage will also be determined by your doctor, as they will consider the benefit to you in comparison to the risk of side effects. When taking too much Junior's acetaminophen, you could risk serious liver disease, which may even be fatal. For adults, it's important not to exceed 4,000 milligrams, 4 grams, of acetaminophen in a single day. If you have liver problems or if you're giving it to a child, you should take less acetaminophen. It's always best to consult your doctor or pharmacist to determine the safe amount for you or your child. You should not take Junior's acetaminophen with any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is a common ingredient in many over-the-counter and prescription medications, such as pain/fever drugs or cough and cold products. Make sure to carefully check the labels on all your medications to see if they contain acetaminophen, and if you're unsure, ask your pharmacist for guidance. If you accidentally take too much Junior's acetaminophen, overdose, seek medical help immediately, even if you feel okay. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes and skin, and dark urine. It's also important to note that daily alcohol use, especially when combined with acetaminophen, can cause liver damage. It's best to avoid alcohol while taking Junior's acetaminophen. Before taking Junior's acetaminophen, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of liver disease or regular alcohol use. It's also important to note that the liquid products, chewable tablets, or dissolving/effervescent tablets and powders may contain sugar or aspartame, so if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances, make sure to consult your doctor or pharmacist before using these products. If you are pregnant or breastfeeding, it's important to consult your doctor before using Junior's acetaminophen. Remember to always follow the recommended dosage instructions and consult a healthcare professional for the best timing to take this medication. When taking Junior's acetaminophen, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Junior's acetaminophen include ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, possibly causing false test results. It's important to make sure that lab personnel and all of your doctors are aware that you are using this drug. As always, it's important to consult with your doctor or pharmacist before taking Junior's acetaminophen to ensure that it is the right medication for you or your child. And remember to follow the recommended daily dosage and take the medication at the optimal time for the best results. If someone has taken too much Junior's acetaminophen and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Remember to seek medical help if you or someone you know may have taken too much Junior's acetaminophen. Acetaminophen is a medication that does not cause stomach or intestinal ulcers like some other pain relievers. However, it does not reduce swelling like those medications do. It is important to consult with your doctor to determine if acetaminophen is the right medication for you. Acetaminophen is commonly used to reduce fever and relieve mild to moderate pain from conditions such as headache, muscle aches, arthritis, backache, toothaches, and colds. It is also used in children to reduce fever and relieve pain. Children's acetaminophen is available in various forms such as liquid, chewable tablets, and melt-away tablets. The dosage of acetaminophen for children is based on their weight, so it is important to carefully follow the dosing instructions provided on the product label. It can be taken with or without food, and the optimal timing for taking acetaminophen is usually every 4 to 6 hours as needed for pain or fever. However, it is important to not exceed the recommended dosage, as taking too much acetaminophen can be harmful to the liver. Always consult with a pediatrician or healthcare professional before giving acetaminophen to children, and never give more than the recommended dose. If your child is taking this medication on a regular schedule and they miss a dose, they should take it as soon as they remember. If it is near the time of the next dose, they should skip the missed dose and take the next dose at the regular time. It's important not to double the dose to catch up. This medication is usually taken every 4 to 6 hours as needed or as directed by a doctor. It's best to take it with a full glass of water. If your child's symptoms persist or worsen, it's important to contact their doctor. Always follow the recommended dosage and timing for this medication to ensure its effectiveness and to minimize the risk of side effects. When it comes to storing Junior's acetaminophen, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place, away from the reach of children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain. Instead, it's best to consult with your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.